In today's video, we explore 16 clinical nursing assistant interview questions and answers. Don't forget to customize these answers to highlight your unique qualifications and experiences. Here's a bonus tip. Research the company and review the job description so you can incorporate key skills relevant to the job role in your answers. You can find the link to general, behavioral, and team-based nursing assistant interview questions in the description below. Question number 1. How do you communicate changes in a patient's condition to the nurse? This question tests your attentiveness, judgment, and understanding of CNA responsibilities. Interviewers want to know that you recognize early signs of change, communicate promptly, and document accurately. The key is to show you're proactive, specific in your reporting, and always prioritize patient safety. Use a clear example or describe your communication process step by step. If I notice any change in a patient's condition, whether physical, emotional, or behavioral, I act quickly and follow the chain of command. My first step is to observe carefully and confirm what I'm seeing, such as changes in breathing, skin color, consciousness, appetite, or mood. I immediately report those observations to the nurse using clear, objective language and relevant details, like when it started, what I noticed, and any actions taken. For example, I would say, Mrs. Smith seems more short of breath since her walk this morning. Her pulse is higher and she's breathing faster than usual. After reporting verbally, I document the change in the patient's chart as instructed by facility policy. If the nurse provides new directions, I carry them out promptly and continue monitoring the patient closely. I've learned that early communication can prevent complications and ensure quick medical intervention. I always treat these reports seriously because timely, accurate information helps the entire care team protect patient health and safety. Question number 2. How do you maintain patient dignity, privacy, and confidentiality? Interviewers ask this to evaluate your compassion and respect for patients' rights. They want to see that you understand how to make patients feel safe, respected, and in control during care. The best approach is to describe specific actions, like knocking before entering, covering patients properly, explaining procedures, and maintaining confidentiality in all discussions. I believe maintaining a patient's dignity, privacy, and confidentiality is one of the most important responsibilities of a CNA. I always start by treating each patient as an individual, showing respect in how I speak, act, and perform care tasks. Before entering a room, I knock, address the patient by name, and explain what I'm about to do so they feel comfortable and included in their care. When assisting with personal hygiene or dressing, I ensure curtains and doors are closed, and I only expose the areas being cared for. I speak softly and respectfully, especially in shared spaces, and I avoid discussing patient information where others can overhear. When handling charts or electronic health records, I never leave them unattended or share details with anyone not involved in the patient's care. Protecting privacy builds trust, which helps patients feel more at ease during vulnerable moments. Maintaining dignity isn't just a rule, it's how I show compassion and uphold the professional standards that every patient deserves. Question number 3. How do you uphold HIPAA and protect PHI during your shift? This question measures your understanding of healthcare privacy laws and professionalism. Employers want to know that you follow HIPAA guidelines and respect confidentiality both inside and outside the workplace. A strong answer highlights awareness, daily practices, and examples of how you prevent accidental breaches. I take HIPAA and patient privacy very seriously because confidentiality is the foundation of patient trust. Throughout my shift, I make sure all personal health information, PHI, is protected, whether it's written, spoken, or electronic. When discussing patient care with nurses or other CNAs, I do so privately, out of hearing range from other patients or visitors. I never leave charts, printouts, or computer screens visible to unauthorized individuals, and I always log off from workstations before walking away. When transporting documents, I keep them face down and secure. If family members ask about a patient's status, I refer them to the nurse or follow facility policy before sharing any details. Outside of work, I never talk about patients, even in general terms. During training, we were reminded that even a casual conversation can violate HIPAA, and that lesson stuck with me. I see privacy not only as a legal requirement, but also as a moral responsibility to protect every patient's dignity, trust, and well-being. Question number 4. How do you build rapport with patients and families? This question assesses your interpersonal skills and emotional intelligence. Interviewers want to see that you can create a warm, trusting relationship with patients and their loved ones. Emphasize listening, empathy, consistency, and communication. Share a small example that shows how you make people feel seen and cared for. Building rapport with patients and families starts with respect, active listening, and genuine kindness. I always greet patients with a smile, introduce myself, and make an effort to learn about their preferences, routines, and comfort levels. I take time to listen to their concerns, even when I'm busy, because often patients just need to feel heard. Simple gestures, like remembering how they take their tea or adjusting a pillow the way they like, show that I value them as individuals. With families, I stay patient and professional, updating them appropriately and listening to their questions with empathy. If they seem worried, I reassure them that their loved one is receiving attentive care, and I notify the nurse of any concerns. During my clinical rotation, one patient's daughter thanked me for taking the time to explain her mother's exercises and for showing patience during visits. That moment reminded me how trust is built one conversation at a time. A calm tone, a few extra minutes, and consistent care can make all the difference. Question number 5. How do you manage patients with dementia or cognitive impairment? This question tests your ability to handle complex patient needs with patience and understanding. Employers want to know that you can manage confusion, agitation, or forgetfulness safely and compassionately. The best answers show communication strategies, emotional control, and awareness of safety measures. When caring for patients with dementia or cognitive impairment, my focus is always on safety, patience, and empathy. I start by approaching them calmly, maintaining eye contact, and speaking softly with simple, reassuring words. I never argue or correct them harshly if they're confused. Instead, I redirect their attention gently towards something comforting or familiar. Consistency helps reduce anxiety, so I try to keep routine steady and predictable. If a patient becomes agitated, I remain calm and give them space while making sure the environment is safe, removing clutter or potential hazards. I also observe patterns and triggers that might cause distress and report them to the nurse so adjustments can be made to their care plan. During one rotation, a patient frequently became upset during bathing, so I learned to play calming music and explain each step before touching them, which helped tremendously. Working with dementia patients has taught me that compassion, patience, and understanding are just as vital as physical care. Every small act of kindness can bring comfort and stability to their day. Question number 6. How do you respond to agitated or aggressive behavior? This question assesses your emotional control, communication skills, and ability to de-escalate tense situations safely. Employers want to see that you can remain calm, avoid confrontation, and protect both yourself and the patient. The best answers include empathy, observation, and teamwork. When a patient becomes agitated or aggressive, I remind myself that their behavior usually stems from fear, pain, or confusion rather than intentional anger. My first step is to ensure my safety and the safety of others while maintaining a calm, non-threatening demeanor. I speak softly, avoid sudden movements, and give the patient space if they need it. I try to identify triggers like loud noises, overstimulation, or discomfort and remove them when possible. Often simply listening and validating their feelings helps diffuse the situation. For example, I might say, "I can see you're upset. Let's take a moment to calm down together." If the behavior escalates or continues, I notify the nurse immediately so the care team can assess and provide support. I document what happened and any contributing factors for future reference. During training, I learned that patience and empathy are the best tools for calming agitation. My approach is always centered on preserving dignity, ensuring safety, and restoring a sense of comfort for the patient. Question number 7. How do you prevent patient falls and keep rooms safe? Interviewers ask this to test your awareness of safety protocols and attention to detail. A strong answer shows that you consistently check the environment, follow facility policy, and communicate with both patients and the care team. Include preventive actions and teamwork. Preventing patient falls is one of my top priorities because it directly affects patient safety and recovery. I make sure to keep call lights, water, and personal items within easy reach so patients don't feel the need to get up unassisted. I also ensure the bed is in its lowest position, brakes are locked, and side rails are used appropriately according to policy. Before assisting a patient to walk, I check for non-slip footwear, secure any IV or oxygen tubing, and verify whether they require a gait belt or assistance device. I always stay close while ambulating and encourage them to take their time. If I notice clutter, wet floors, or loose cords, I remove the hazard immediately or report it to maintenance. I also perform hourly rounding to anticipate needs before a patient tries to move alone. During my clinical rotation, this approach helped reduce near falls in my assigned area. Consistency, awareness, and teamwork make all the difference. I treat every patient interaction as an opportunity to keep them safe and maintain a secure environment. Question number 8. How do you prevent pressure injuries and reposition patients? This question measures your understanding of prevention and early intervention. Employers want to know that you follow repositioning schedules, use proper technique, and communicate concerns promptly. Mention routine checks, equipment use, and documentation. I prevent pressure injuries by being proactive and attentive to every patient's mobility and skin condition. I reposition patients who are bedbound at least every 2 hours, following their care plan and using proper body mechanics to avoid injury. I also check high-risk areas like heels, elbows, and the sacral region for redness or irritation during care. When I reposition, I use pillows, wedges, or pressure-relieving devices to distribute weight evenly and reduce friction. I make sure linens are clean, dry, and wrinkle-free, as moisture and folds can contribute to skin breakdown. If I notice any redness, I report it to the nurse immediately and document it according to policy. I also encourage patients who can move independently to shift positions frequently and explain why it's important. During my clinical experience, I worked with a nurse who emphasized the look, lift, and listen approach. Observe the skin, lift pressure areas, and listen to the patient's comfort level. That method taught me how small, consistent actions prevent serious complications and maintain comfort and dignity for every patient. Question number 9. Walk me through your process for taking vital signs accurately. This question evaluates your technical competency and attention to detail. Interviewers want to see that you understand the correct procedures, know normal ranges, and record results precisely. Show you value accuracy, consistency, and patient communication. When taking vital signs, I always begin by washing my hands, gathering clean equipment, and greeting the patient respectfully. I explain each step before I begin because understanding what's happening helps reduce anxiety. I start by checking temperature using the facility-approved method, oral, tympanic, or axillary, and ensure the thermometer is sanitized before and after use. Next, I take the pulse for a full minute to note rate, rhythm, and strength, followed by counting respirations discreetly so the patient breathes normally. For blood pressure, I use a properly sized cuff, position it correctly at heart level, and record both systolic and diastolic readings accurately. I also observe for signs of pain or discomfort and note any irregularities, such as a weak pulse or abnormal rate. Once I've finished, I record all readings immediately and report any abnormal results to the nurse without delay. I've learned that accuracy and consistency are vital for detecting changes early, and I take pride in being meticulous. Taking vital signs isn't just routine, it's the foundation of monitoring a patient's overall health. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 10. How do you document care and report intake and output? This question measures your accuracy, accountability, and understanding of documentation procedures. Employers want to ensure you follow policy, maintain precision, and report promptly to support quality care. Mention both recording and communication steps. Accurate documentation is essential to ensure continuity of care and maintain compliance with facility and state regulations. When recording intake and output, I start by measuring everything precisely: fluids consumed, IV amounts, and urinary or bowel output. I use the correct units of measurement and double-check entries before submitting them in the patient's chart or electronic health record. I document immediately after performing care, never at the end of the shift, to avoid missing details. If I notice abnormal patterns, such as sudden weight gain or low urine output, I report them to the nurse right away. I also include relevant observations, like changes in appetite or unusual color or odor in urine, as these details can help identify potential issues early. During training, I developed a habit of reviewing my documentation for accuracy before closing the chart. I view documentation as more than paperwork. It's a vital communication tool that ensures every team member knows exactly what's happening with each patient. Reliable, precise charting supports better decision-making and strengthens patient safety. Question number 11. What is your experience assisting with activities of daily living? This question evaluates your hands-on skills and understanding of patient care routines. Interviewers want to see that you can support independence, follow care plans, and maintain dignity while assisting with personal tasks. Focus on compassion, consistency, and safety. I have strong experience assisting patients with activities of daily living such as bathing, dressing, grooming, toileting, and eating. My approach is always centered on respect and promoting independence as much as possible. I begin by explaining each step of care so the patient feels comfortable and in control. For example, during a bed bath, I cover the patient with a towel to maintain privacy and only expose one area at a time. I also encourage them to do what they can on their own, such as washing their face or brushing their hair, because it helps preserve dignity and self-esteem. I ensure safety throughout, locking wheelchairs, checking water temperature, and using non-slip mats when needed. During my clinical experience, I assisted residents in a long-term care facility with morning routines and meal assistance, adapting my care to each person's mobility level. I've learned that patience, communication, and attentiveness transform routine tasks into moments of comfort and connection. Supporting someone's daily needs is deeply rewarding because it restores confidence, promotes well-being, and builds trust between caregiver and patient. Question number 12. How do you maintain infection control and standard precautions? This question tests your knowledge of infection prevention and safety compliance. Employers want to confirm that you understand proper hygiene, PPE use, and facility protocols. Show you follow procedure consistently and protect both patients and staff. I maintain infection control by following standard precautions consistently with every patient, regardless of their diagnosis. I always begin and end care by performing proper hand hygiene using soap and water or alcohol-based sanitizer. I wear the appropriate personal protective equipment, such as gloves, gowns, or masks, based on the type of care and level of exposure risk. I also change gloves between patients and tasks to prevent cross-contamination. When handling linens, I hold them away from my uniform and place soiled items in designated bags immediately. I make sure shared equipment like blood pressure cuffs or thermometers are disinfected before and after each use. During my clinical training, I saw how small oversights could lead to big consequences, which made me very attentive to detail. I also remind others politely if I notice a break in protocol, because infection control is everyone's responsibility. Maintaining a clean and safe environment not only protects patients, but also creates trust. I take pride in knowing that by strictly following these precautions, I'm contributing to a healthier and safer care setting for everyone. Question number 13. How do you approach end-of-life care and family support? This question assesses empathy, emotional maturity, and communication skills. Employers want to see that you can provide compassionate care to patients and families during difficult times, show understanding, respect, and professionalism. When providing end-of-life care, I focus on comfort, dignity, and emotional support for both the patient and their loved ones. I ensure the environment is peaceful, clean, and respectful of the patient's preferences, whether that means adjusting lighting, playing soft music, or simply being present quietly. I perform care gently, explaining each action so the patient feels safe and respected. Often, nonverbal communication, like holding a hand or offering a calm presence, can be more comforting than words. With families, I listen patiently, answer within my scope, and refer questions to the nurse when needed. I also respect cultural or spiritual preferences that may guide the family's wishes. During clinical rotations, I helped care for a hospice patient whose family was struggling emotionally. By keeping the room calm, offering tissues, and providing reassurance that their loved one was comfortable, I helped create a supportive atmosphere. Those moments taught me that compassion and presence are as vital as medical care. My goal is always to make a patient's final moments peaceful, dignified, and surrounded by empathy. Question number 14. How do you assist with mobility, transfers, and safe lifting? This question checks your knowledge of body mechanics, patient safety, and teamwork. Employers want to ensure you prevent injury while helping patients move or transfer. Mention using equipment properly and communicating clearly. I always prioritize safety and proper technique when assisting with mobility and transfers. Before starting, I assess the patient's strength, balance, and comfort level, and I review their care plan for any movement restrictions. I make sure the area is clear of obstacles, equipment is ready, and the bed or wheelchair brakes are locked. When lifting or transferring, I use proper body mechanics, keeping my back straight, bending at the knees, and lifting with my legs instead of my back. I always communicate each step to the patient, encouraging them to help as much as they can to maintain independence. For patients requiring more assistance, I use transfer belts, slide boards, or mechanical lifts as trained. I also ask for help from another staff member when needed because teamwork ensures safety for both the patient and caregiver. During my clinical experience, I assisted many patients with mobility exercises and transfers, learning that patience and preparation prevent accidents. I never rush movements and always prioritize comfort and stability. Safe mobility is about trust, communication, and protecting both the patient and the caregiver from harm. Question number 15. How do you handle patients who refuse care? This question reveals your communication skills, respect for autonomy, and problem-solving ability. Employers want to see that you respect patients' rights while ensuring their safety. Emphasize empathy, understanding, and reporting. If a patient refuses care, I always respond with patience, empathy, and respect for their autonomy. My first step is to stay calm and try to understand the reason behind their refusal. Often, it's related to discomfort, fear, embarrassment, or a desire for control. I explain the importance and purpose of the care in simple, reassuring terms, focusing on how it benefits them. For example, I might say, I understand you don't feel up to it right now, but a quick bath will help you feel clean and prevent skin irritation. If they still decline, I give them space and offer to return later, unless the refusal poses immediate health risks. I document the refusal according to policy and promptly inform the nurse so appropriate steps can be taken. During training, I encountered a patient who refused meals due to nausea, and after we reported it, the nurse adjusted their diet plan successfully. That taught me that respectful communication and teamwork can often turn resistance into cooperation while preserving patient dignity and safety. And finally, here is the last of our clinical nursing assistant interview questions. Question number 16. How do you support pain management within your scope? This question tests your understanding of your CNA role and your ability to recognize and report discomfort. Employers want to ensure you observe carefully, provide comfort measures, and communicate effectively with nurses. As a CNA, my role in pain management focuses on observation, comfort, and timely reporting. I pay close attention to verbal and nonverbal cues such as facial expressions, restlessness, moaning, or changes in behavior that might indicate pain. When I notice signs of discomfort, I ask the patient to describe their pain level using the facility's scale and document the details accurately. I report findings immediately to the nurse so they can evaluate and adjust treatment if necessary. Within my scope, I also use comfort measures such as repositioning the patient, offering a warm blanket, assisting with relaxation techniques, or adjusting the environment for quiet and comfort. During my clinical experience, I cared for a post-surgery patient who couldn't express pain clearly, so I noticed subtle signs like tense shoulders and shallow breathing. After reporting it to the nurse, pain medication was given and the patient relaxed shortly after. That moment reinforced for me that prompt observation and compassionate care play a vital role in pain management. My goal is always to advocate for the patient's comfort and well-being while supporting the nurse's plan of care. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.